Wow. Good morning, everybody.
Good morning.
I'd like to start by telling you about my friend Sam. He lives in Arlington, Texas, where he rents a room at a boarding house, and he walks to work each day at a local fast food restaurant. Now, Sam struggles with asthma, and every now and then, he really has a hard time catching his breath, and it terrifies him. And so he'll race to the ER, where he'll receive a breathing treatment and a refill for his rescue inhaler and a $3,000 bill. Did you catch that? A $3,000 bill, because you see, Sam is uninsured. He's considered a frequent flyer by the ER staff because they see him 2 or 3 times a month. Now, Sam doesn't want to be in this situation. He'd much prefer to have his asthma under control. He'd prefer to have a medical home, and I guarantee you he'd prefer not to get those $3,000 bills. But as a low-income, uninsured worker, you know, he just doesn't feel like he has a lot of options for his chronic disease management. It sort of seems like all the healthcare cards are stacked against him. Well, I'm John Mills. I'm a senior clinic consultant with Empowering Church Health Outreach. I'm also the son and the grandson of community pharmacists. And I remember as a young man watching my father extend credit to his customers who couldn't afford to pay cash for their prescription medications. You know how expensive prescriptions can be. But these folks were on a fixed income, and many of them were having to choose between buying food or paying for their medications. And when my father had to close his store, he was owed over $70,000. You see, I think our healthcare system is broken, because there's over 30 million people like Sam in our country who are uninsured. But there's over 50 million whose health insurance premiums, deductibles, are so high that they put off going to the doctor, where some of those early interventions can have the greatest impact, and that would prevent those ER visits down the road. So what can we do to help people like my friend Sam? Well, at his last trip to the emergency room, Sam was referred to the Open Arms Clinic in Arlington, which is a free medical clinic that ECHO helped to start. And at his first visit at Open Arms, he saw a physician, just like in the emergency room. But the doctor also suggested that Sam meet with the clinic's social worker, who is a community volunteer who comes in a couple of times a week. Julie, the social worker, took the time to get to know Sam and interviewed him about all aspects of his life: his job, his relationships, nutrition, exercise. And because she knew that Sam has asthma, Julie asked some more probing questions about his living situation. And she learned that Sam didn't have anywhere to store his clothes after he cleaned them. In fact, Sam told her that he was using a cardboard box to store his clothes and that they were often damp. Well, after learning this, Julie made a quick call to her husband, who took his truck to the Goodwill. And now this is Texas, so everybody's got a truck. And at the Goodwill, her husband bought Sam a $10 wooden chest of drawers where he could store his clothes. And Julie really stressed the importance of making sure he dried his clothes thoroughly before putting them away. So you see, by getting to know Sam and asking some deeper questions, Julie uncovered the major aggravating factor for Sam's asthma: mold. by storing his clothes in a cardboard box and they were damp. He was wearing moldy clothes a lot of times, and that really aggravated his asthma. Well, Echo is working hard to help make this kind of whole person affordable health care available to everyone in our country who wants it. We offer no-cost consulting services, tools, and resources to medical professionals who are called to start nonprofit clinics. Because, and I bet this won't come as a surprise to you, the business of medicine and all those regulations, well, shoot, it's complicated. And we just know it's easier with help. Echo has helped to launch over 90 clinics in 28 states that are serving over 250,000 people. And we've learned a ton after helping start 90 clinics. And we share that information. Did I mention it was at no cost? We share that information with medical professionals like Dr. Stephanie Dielman, who, after serving for 5 years at a mission hospital in Papua New Guinea, was called home by the Nazarene Church and asked to move to Cactus, Texas, population 3,179, and start a medical clinic. Now, Stephanie is a fabulous physician with a heart for service. But frankly, she didn't have a clue where to begin, because after years of medical training and all those years of service on the mission field, nobody had ever told Stephanie how to start a nonprofit organization or recruit a board of directors, how to find a location or purchase malpractice coverage, how to start a community garden or a teaching kitchen where she could help her patients learn how to prepare healthy meals. So Echo suggested that Stephanie put a team of people together that shared her vision. And then Echo walked side by side with Stephanie and her team all through the clinic development process. And after 13 months, the Well Health Center was launched in Cactus. Now, Stephanie swears that she could not have done this without Echo's help. I personally believe Stephanie can do anything. But we probably did shave 12 months off the clinic development timeline. And just think of the number of patients Dr. Dielman was able to serve in that 12 months. Well, you know, I've recently become a grandfather. And my hope for Amelia Grace and the world that she grows up into is that she and everyone else will have access to affordable, quality health care. And that she will have medical providers that see her as a whole person. And that if she struggles financially, she won't have to sacrifice her health. Echo is working hard to make that dream a reality. And you can join us by introducing us to medical professionals in your community and by sharing your time and your treasure. Together, we can build a world where everyone is healthy enough to live their best life. Thank you.